Welcome, everyone. My name is Paul Shuckett, and I am a Community Development Coordinator at Parkinson Canada. Thank you for joining us today for our webinar on nutrition and Parkinson's disease. I would like to take this opportunity to inform everyone that today's session is being recorded for future viewing and can be accessed by visiting our website at www.parkinson.ca and visiting our YouTube channel. Before I introduce our speaker, I have a few housekeeping points to review. For technical support at any time during today's webinar, please click the Tech Support button at the lower right of your screen next to the Ask a Question button. You will have an opportunity to submit questions at any point during today's session from your computer screen. Just click on the Ask a Question button at the bottom right of your screen and type in your question. Every effort will be made to answer all questions at the end of the presentation, but we ask that questions are of a general nature and not seeking medical advice. And now I'd like to provide a brief introduction of our presenter today. Nicole Shuckett graduated with a Master of Science Nutrition and a certificate in Gerontology from Case Western Reserve University in 1996. She is a member in good standing of the College of Dietitians of Ontario for over 20 years and started her career at Baycrest, where she developed a passion for working with older adults and their families. For the past 8 years, Nicole has worked at the Jeff and Diane Ross Movement Disorders Clinic and the ALS Clinic at Sunnybrook Hospital for the Assistive Technology Clinic. Nicole is an active teacher and presenter on nutritional issues in both the corporate and public sector and has an active private practice in the North York area of Toronto. I will now turn it over to Nicole Shuckett. Welcome, Nicole.
Hi, everyone. I am your presenter for the next hour. I hope everyone can hear me well as I speak to you from an office in Toronto going out to the entire country, which is pretty awesome technology. So for the next hour, I'm going to be speaking to you about nutrition and Parkinson's disease. And we are going to wait till the end for questions. So everyone think of questions while I'm speaking, and please type them in, or there's other ways that questions can get across. So what am I going to talk to you about today? As I press the keys that don't move. There we go. We're all good here. So the sections that I'm going to cover today is I'm going to basically review what a healthy diet is. I'm going to talk about the nutrition-related symptoms of Parkinson's disease. I'm going to review the management of nutrition-related symptoms of Parkinson's disease. And then I'm going to end off talking about protein in L-dopa, which is one of the most common medications that is used to treat Parkinson's disease. So one of the biggest questions that I always get asked is, why is it so important to be having a good diet when you have Parkinson's disease or any other illness for that matter? Why is it so important to have a good diet? We need to make sure that we have a good balanced diet to give us energy, to provide building materials for our body to grow, to support our immune system, to prevent diseases, and to help maintain a healthy weight. So what is good nutrition? Good nutrition is basically eating a healthy diet, maintaining a healthy weight, eating regularly, not skipping meals. So you want to be eating breakfast, lunch, and dinner and some snacks in between each and every day, 365 days of the year. If you miss every couple of days, that's okay. You want to be getting enough fluids as well, which are very important. Be drinking about 6 to 8 cups daily of fluids. And you want to make sure that you keep your bones healthy. So you want to make sure you're having about 1,200 milligrams of calcium and 1,000 international IU of vitamin D daily. And I'm going to talk about getting that in a few seconds. So everyone often asks me, what is the diet I should be following for Parkinson's disease? And unfortunately, there is no special answer. The special answer is eating a wide variety of foods from the 4 food groups. So all of us Canadians basically following a version of Canada's Food Guide to Healthy Eating. We want to make sure that we're eating a good amount of all these foods to give our body the nutrients they need to work as a person every single day. So what are these foods and where should they come from? So everyone should be eating a good variety of vegetables and fruit. They're an excellent source of vitamins, minerals, and antioxidants and fibers. And we want to try to make sure that we're choosing ones that are deeper and brighter in colors, such as spinach and berries and tomatoes. So you want to make sure they're really good colored ones. You want to make sure they're fresh, or if you can't get fresh, you have frozen, or if you have to have canned ones, you want to make sure they're ones that are not packed in all kinds of sugary juices. You can eat these fruits and vegetables raw, cooked, cut up, mashed, pureed, or even juiced. You just want to make sure you're having a good amount of vegetables and fruit every single day, at least 5 servings. Then we want to make sure we're having enough grain products every day. Grain products, which include things like pasta and bread and rice and cereal. And we want to make sure that those are whole grains because they provide us really good sources of fiber, carbohydrates, and vitamins. And we want to make sure that our diet has servings of grain products at every single meal. Don't stop eating grains because someone said to you they're not good. They're very good. You just want to make sure you're eating the white grains. Then we want to make sure we're having enough servings of milk and alternatives. And each Canadian over 65 needs to be having at least 2 to 3 servings of these products every day. This includes dairy products such as milk, cheese, yogurt. It also includes fortified soy or almond milk instead of milk. And you want to make sure you're having a good serving of those every day. And if you're not getting your milk and alternative products every day, which is the hardest thing to get as a Canadian, some people cannot get them, then you need to be taking a supplement of calcium or also including some vitamin D. Then the final food group that everyone needs to be eating is meat and alternatives, which are very good sources of protein, fat, and iron. And you should try to enjoy good sources of this, such as chicken, lean meat, fishes, nuts, seeds. You really want to make sure you're having at least 2 servings of fatty fish every day, such as herring or mackerel or sardines or trout, as they have really good servings, good inclusions of really good vitamins with you. The other thing you want to try to get more of, and we're going to talk about this at the end of the presentation as a good alternative for people with Parkinson's, is you want to make sure you also have legumes as your meat and alternatives, because they're plant sources that are high in protein, and they're very high in vitamins, minerals, and fat, and fiber, and low in fat. So you want to try to have things like beans, lentils, chickpeas, at least 2 to 3 times a week. So those are basically the healthy diet you should be following in your daily eating. And I talked about these superfoods that exist. And to get these superfoods that are really important not only in Parkinson's disease, but in a wide variety of different illnesses to help prevent and to help make sure you're eating all these great foods, is you want to have as much superfoods as possible, which are going to be rich in antioxidants and good fats. So you want to have a lot of bright color fruits and vegetables, which I discussed, fatty fish, nuts, olive oil, avocados, dark chocolate, red wine. All of those are superfoods that you should be incorporating into your diet if you have Parkinson's or if you do not have Parkinson's, because they're just really important, and keep making sure that your entire intake is really good every single day. So you want to be eating all these foods. Then the other thing you have to do in terms of not in addition to eating is also drinking well. And drinking well is important in all aspects of a person, if they have Parkinson's or not, because it helps prevent many illnesses and it helps keep our bodies healthy. And actually water is considered the nutrient. In fact, it's more important than all the other nutrients we have. And we want to make sure we're drinking a minimum of 6 to 8 cups of fluid per day. That fluid can be water or juice. It can be really anything. The water, the juice, and is going to have more sugar in it, but it constitutes fluid. Or even having a cup of soup or very wet vegetables or fruit like watermelon or applesauce. All of those things constitute a fluid. What I sometimes recommend is to fill up a jug at the beginning of the day with 8 cups of fluid in it, and by the end of the day you should have it done. And just as a side, anything with caffeine in it, such as coffee or tea, will not constitute as part of those fluids. It, in fact, is going to make you more dehydrated. So you want to try to have more water and less coffee in terms of keeping yourself as well hydrated as possible. So that basically sums up what a healthy diet is. Now, what you all want to hear about mostly today is the nutrition-related symptoms of Parkinson's disease and how to deal with them. I'm going to review the big ones today. There's many more, but these are the ones that most people in our clinic deal with, and I feel that all of you should hear more about them so you know how to work with them and how to deal with them. The big ones that we're going to discuss today are weight change, weight loss, and weight gain. I'm going to discuss some GI issues such as constipation and gastric emptying. I'm going to look at dysphagia or swallowing issues. I'm going to discuss drug-nutrient interactions, as many people with Parkinson's disease are taking a multitude of medications, and how these medications can impact nutrition. And there are issues that occur such as a dry mouth, excess saliva, or orthostatic hypertension when your blood pressure may drop. And we'll also end with talking about bone thinning. So in terms of weight change, so most people who have Parkinson's disease often have weight loss, which I'm going to talk about after. But I also want to talk about weight gain, because some people in our clinic come to us and they just have gained all this weight and they're having an issue controlling their weight, and they wonder why most people lose weight. Well, most people do lose weight, but some people do gain weight. And one of the reasons why people gain weight who have Parkinson's disease is because they've maybe eating the same way as they've always eaten, but all of a sudden their mobility level decreases. So they're not burning off the calories that they used to be able to burn, so now they're gaining weight. So one of the things to deal with if you're gaining weight is to just really watch your diet and make sure you're not eating as many high-calorie foods, eating more fruits and vegetables, and being cognizant of your serving sizes, and try to being able to move as much as possible within the permutations of your illness. But weight loss is more common in our Parkinson's patients. Oftentimes, when a person comes to our clinic, they've already lost all this weight. They've had this initial weight loss before they've even been diagnosed, or sometimes people have this gradual weight loss as the disease is progressing. And this can be caused by a multitude of things. It can be caused by increased caloric needs. People who have tremors are burning calories, so there's an increased need of calories in the diet. It can be caused by, weight loss can be caused by constipation. If you're not going to the bathroom well, you don't want to eat. It can be caused by GI issues. You just are not feeling well, so you're not eating well. It can be caused by dysphagia. A person who's having swallowing problems is not getting the food that they need. And I'm going to go through in more detail to some of these issues. But if you're not able to swallow and you're not swallowing well and getting the food that you need, you're going to definitely have some issues with getting enough calories. Nausea is also something that occurs. Often nausea occurs as a result of the medication you're taking, and I'll talk about some tips about that. Then the last two I'm not going to go into more detail later on, so I'm going to address them right now. Loss of taste or smell is very common in Parkinson's disease. It's one of the things that most people actually know is one of the first signs that they have the illness. So in terms of that, it's telling people that they can either add extra spices to make the food taste better. If they can, if their health allows it, you can add extra salt. But adding ginger to food, different kinds of spiciness to food can help with the taste of smell, the taste of food. Or sometimes I just have to tell people, even though you can't taste the food, you have to still eat it because your body needs the food that it's eating, so it's really important. Then food access can also become an issue for people with Parkinson's. They can't get out to buy their groceries. They're having more difficulty preparing food. So some of the things that we deal with in terms of that is having groceries delivered to a person in their home, having more prepared food, accessing Meals on Wheels, or the multitude of other home delivery meal services that are out there. All of those can help with food access to ensure people get the food that they need every single day, 3 times a day. So what do we do about this weight loss? So one of the most easiest things to do if people are losing weight is to increase the calories in a person's diet. Often people say, wow, that is so much fun. I'd love to be able to increase the amount of food that I'm eating. And I often say to family members, I take no responsibility if you gain weight. My goal is for my client to be gaining weight. So how do you get a person to gain weight? So you have more frequent meals during the day. You increase the calories in the diet by adding higher calorie foods such as avocado, olive oil. In terms of fat, you avoid lower fat foods, so you may have a higher fat yogurt. You can have ice cream. You can increase your portion sizes. All of those things can help increase calories, or you can have high-calorie smoothies. Or if you're not able to prepare all the food to increase the calories, you can also turn to nutritional supplements such as Ensure Plus or Boost Plus or whatever nutritional supplement happens to be on sale at the grocery store. Everyone makes them now. You can get them at Walmart. You can get them President's Choice brand, Costco brand. All of those nutritional supplements have a lot of extra calories in them, so they can help boost about the amount of calories you're getting in your diet every day. Now, if a person is losing weight, you want to make sure that the weight is being monitored. So on a weekly or every 5 days, just to keep track of weight to make sure weight loss is not occurring, and to make sure that you are aware of this and making sure that you provide yourself or your client with more nutrients to prevent the weight loss from occurring. So constipation is another issue that occurs in almost every single Parkinson's patient. I think that in a clinic on the weekly basis, I must talk about constipation to almost every single one of our I must talk to every single one of our clients about constipation. So there's different definitions of constipation. Some people say that it's no bowel movement every day or every other day. Others say that it's fewer than 3 bowel movements per week, that the stool has become harder in more than 25% of the bowel movements. The other problem that's more common in Parkinson's patients is that there's a feeling of an incomplete evacuation, so that you're not able to get the bowels to move out, and you have excessive straining in more than 25% of your bowel movements. And all of this is occurring in people with Parkinson's disease. And why is this happening in terms of most of the population that have Parkinson's disease? We know that there's a slowing of bowel muscles during Parkinson's disease of the whole body, but there's also slowing of movement in the GI tract. So because it's slower in the GI tract, it's affecting how the food moves through our body, and we're able to eliminate it. So that's something that's happening more and more often. There's also less physical activity occurring, and if a person is more active, their bowels move much better. So that's one of the things that is causing people with Parkinson's to have constipation. Also, many people with Parkinson's disease are taking a multitude of medication, and often medication can cause people to have constipation, and also diet changes. If a person's not eating a well-balanced diet, they are going to have more likelihood of constipation. So that's what really is occurring. So then we say, okay, so this constipation is occurring. How do we manage it, and how do we make sure that our bodies are getting things to prevent this constipation to occur? So on the non-diet side, I always tell my patients to increase their exercise or physical movement as high as possible within their ability, because that really helps the body move as much as possible and gets everything moving in the stomach. So we want to make sure that is happening. We want to have more fluids, and increasing your fluids actually happens before you change your diet, because if you're not having enough fluids, the foods can't flow through the body as well, and if you increase the fiber, which is very important in constipation management, if you don't also increase the fluids, they're actually going to have a counteractive effect, and it's going to make things worse. So you want to have more fluids, and then you also want to have more foods that are high in fiber. So things like fruits and vegetables, whole grain bread and bran cereals. I'm a huge proponent of bran buds, that basic first cereal that was made by Kellogg before they started making all these other cereals. So having Kellogg Bran Buds really, really helps. Another thing that can really help is making a concoction. We call it Bran Delight here, but there's different things that it's called, where you just take some applesauce and some Bran Buds and some prunes and mix that all together and eat that. That can help. You just really need to eat more fiber in your diet. So having things like wheat or oat bran or psyllium seeds all helps to increase the fiber in the diet. Now, when you eat the fruits and vegetables, you also have to make sure you're eating the core, like the skin of the apple, or if there's little seeds, that all has the fiber. Or if you're having whole grain bread, it's the little seeds in the bread. That's where you're going to get all your fiber from. Now, if the fiber and the fluids and the mobility isn't working, the first line of defense to help with the constipation is to go to medications that you can just buy in the lines of the grocery store or the pharmacy. So the one that we recommend the most, even though there's things like Metamucil and Benefiber, but what we recommend the most, and I wish I had stock in the companies that make it, is a product called PEG 3350, which is sold under the brand names of Laxaday, Restoralax, Relaxa, whatever on sale brand, basically, and it's all in a pink bottle. And this product, you take it mixed with water or anything else once a day, really helps things keep moving. And I recommend that people take it every single day or every other day and not stop. You need to be taking it always, not just when the constipation occurs, in order for it to get its full effect. Some people also, in addition to this, may require a stool softener that you can get also over the counter. And then once these over-the-counter medications do not work and you still have problems, because this actually can occur in many, many patients, you are going to need something that is going to be written by a script from a pharmacy, and there's a wide variety of different medications that your doctor may recommend to help with the constipation. But what I really want to make really high note of in terms of the constipation is to make sure you have a good bowel routine. Some people, if you just go on the toilet at the same time every single day, it really helps things get going. The other thing is, if you don't have a bowel movement in, let's say, after 4 or 5 days, seek the advice of someone, because it can become dangerous if you don't go to the bathroom more often. So it's really important that you're making sure that you're as well, that you're doing well in terms of the constipation. Another thing that is occurring are GI issues that are occurring in the stomach. This also often is occurring because there's delayed stomach emptying in Parkinson's disease, and you get this feeling of being bloated or belching or heartburn, and you have this full feeling in your stomach. So you want to make sure that to help with this, because this is one of the things that's also not going to make you want to eat, is you try to do things that help to counteract this. I've had patients say that they feel like there's like a pain shooting through them. It's almost like the tremors are occurring in their stomach, and when they go on or off, it gets worse. So if you can control that in the times you're eating, that really, really can help. So some of the things that people do to help these GI issues, and everybody's different in terms of dealing with the GI issues, is limiting alcohol, caffeine, and carbonated beverages. Everybody is different if this helps or not. To make sure you sit upright at mealtime and 45 minutes after eating. Limit the foods that trigger the symptoms. Everyone has different foods. Some people it's spicy, some people it's salty, some people it's acidy. Everyone has different triggers, and you need to modify your diet in terms of what those triggers are for you. You want to avoid straws and sucking on candies, because for some people, when they draw in the air, it makes them have more belching and feel worse in their stomach. And some people require a gastric motility agent or a medication from their doctor that can help with dealing with the GI issues that are occurring. Now, a big thing that occurs in people with Parkinson's disease is dysphagia and swallowing issues. There are swallowing and chewing issues are very common in Parkinson's disease as the disease progresses, and it's due to muscle weaknesses in the tongue and in the mouth. It's due to tremors that are occurring and poor oral control. The ability to swallow a glass of water requires the usage of tons and tons of different muscles in the brain, in the throat, all over the body. And if they're not working properly, it can affect the ability for you to be able to swallow both solids and liquids, and it becomes much more difficult to eat. Now, in our clinic, we're very lucky that I work with a speech-language pathologist that helps to assess patients that have dysphagia, and with myself and her work together to come up with strategies to help people with dysphagia being able to eat as well of a diet as possible and maintain their current weight. So some of the things that have to be done in terms of helping to deal with the dysphagia is you alter the texture of the foods or the liquids. So you may start with, if you have all of a sudden it's more difficult for you to chew some nuts or to chew salad or to chew things, you may have to soften the foods that you're eating, or even to mince them or puree the foods so they're more like a very soft texture, so it's easier and you don't have to chew and they can just go down. Another thing that to help swallowing liquids, because it's very difficult to swallow a thin liquid, it actually involves the most amount of control in your body, is you thicken the liquids. So in order to thicken liquids, there are products that are made by different companies to thicken liquids, or else just having a thicker liquid to drink, like a mango nectar or a smoothie or a guava juice, things that are just thicker and easier to swallow, or even applesauce as a substitute, can all help. And as I said before, working with a speech-language pathologist, if you have any swallowing problems, is very, very important, as together we work together to make sure that you maintain the nutritional health as well as possible during the disease process. One of the things that is often occurring as the amount of medications, even as soon as you start taking the medications or as the medications are working in your body, is different things that are occurring in your body and as a result of all these medications that you're taking. And I just happen to have a dry mouth, so I just took a sip of water while I was speaking with you, so excuse me for that. So the often things that are occurring from all these different medications, and some people with Parkinson's disease often tell me, don't make me take another medication, I'm taking 35 already. And from all those medications that you're taking, you often can have either a dry mouth or the opposite of a dry mouth. You're having excess saliva. You can experience nausea. That's very common, especially at the beginning of the disease. Or you have blood pressure changes. And we're going to talk about each of those right now. So a dry mouth is very common as the amount of medications increases, as your breathing may change with the disease, or just because you're not drinking enough. So how do you help with a dry mouth? You increase your fluid intake. I like to say that people that should be walking around with a bottle of water with them so they can increase the amount of fluid they're drinking every single day. There's other products that can help with a dry mouth. There's a whole product line of things called Biotin or Biotin products, where there is a product, they make products such as mouthwash, an oral gel, toothpaste, a spray. There's a spray called Moisture that you can spray in your mouth. All those things can help with a dry mouth. And for some people, just sucking on a candy during the day can help with a dry mouth. So whatever works for you is something you need to be doing if you are experiencing dry mouth symptoms. Now, another thing that is happening is excess saliva or changes in saliva. I've often heard my patients say that they have like a thick, ropey saliva. They can almost pull the saliva out of their mouth. So that is something that is occurring. Or they have tons of excess saliva. The excess saliva may be caused because you're not swallowing as often. So in order to manage the excess saliva, some of the things that we recommend that people do is to have more fluids. I know that kind of seems counterintuitive. As you're drinking, you think that you have all this wet, so you don't want to have more fluids, but actually drinking more fluids can help. There used to be people who said that if you had that thick, ropey saliva, you can try something like a pepin, like a meat tenderizer product to help break down the saliva that's in your mouth. That's something that can help. Talking to the speech-language pathologist can help. And then also different medications can help. If things get to an extreme, you can talk to your physician about different medications that can help control the saliva. There's even people who have Botox treatments to help control the saliva, but that comes after you've tried all different avenues. Now, nausea is something that is occurring very often in people that have Parkinson's disease. In fact, I think I hear more and more people talking about nausea than they talk about other things. Nausea is occurring as a result often of taking so many different medications. It may be a side effect of the medication or because you're taking so many different medications. Now, there's different ways to control the nausea. You can take your Parkinson medication with soda crackers or fruit, and that's something that you want to try. You can try ginger. You can drink it as a tea, or you can actually get like ginger, pieces of ginger at a health food store that is really common. Don't allow yourself to get hungry. Getting hungry can make you nauseous. Some of the things I also recommend with nausea is to make sure you've eaten as soon as you wake up in the morning. I know that there's a common something when people have morning sickness when they're pregnant, they often recommend keeping soda crackers by their bed so that they, as soon as they wake up in the morning, they eat something. I often recommend this with the Parkinson's patients to eat something right away so you don't allow your body to get nauseous. You can make sure you try different things like drinking some ginger ale often helps. The thing about nausea is you should tell your doctor if your nausea is very bad and it's affecting how much you're eating and you're losing weight, because they can treat it with different things. But every person deals with nausea differently, and every person's going to have different tips or ways to help control the nausea to keep it under control for them. And some people have nausea at the beginning, and then once their bodies are used to the medication, the nausea stops, so it is not an issue. Now, another thing that often occurs is blood pressure changes or lightheadedness, that feeling that you feel dizzy as soon as you stand up. This is also a side effect of the medications that are occurring in your body. So you want to make sure that this doesn't happen, because if you become dizzy, you become risk of falling because your blood pressure is dropping. So you really want to make sure that your body has enough foods in it to prevent the blood pressure from occurring. So some of the things that we recommend in terms of helping with the blood pressure changes is to eat more often, so not allowing your blood pressure to drop. Having less sugar, because sometimes sugary foods makes your blood pressure increase, so you want to make sure you're having less sugaring. You want to make sure you're having more fluids, which seems to be my running theme throughout this whole thing, is to make sure you're having enough fluid intake during your body, because it helps prevent many things. You want to decrease or limit the amount of alcohol you're drinking. And finally, the most important thing to remember is to have more salt. Because if your blood pressure is low, you need to have more salt in your diet so it can raise blood pressure. As we all hear in the news, we are telling people to have less salty foods. But for Parkinson's patients who have low blood pressure, they need to have more salt in their diet. So some of the ways to get more salt in your diet is by having things like potato chips or ketchup or drinking bouillon soup. All of those things will help increase the amount your blood pressure and keep it high. And some people need to have that every single day, multiple times a day, to get their blood pressure up to a level that is good for them and that is healthy. Now, it's very common in people with Parkinson's disease to have bone thinning, and bone thinning leads to osteoporosis, and osteoporosis can lead to bone fractures when a person falls. So if you're having difficulty walking and you happen to fall, if you have osteoporosis, you're more at a risk of having a fracture when you fall. That's why we want to make sure that our bones, our body is as well padded as possible and not to lose weight, because if you fall, you want to have some padding on your body to prevent these bone fractures from occurring. In order to prevent bone thinning or osteoporosis, you want to make sure you have a diet rich in vitamin D and calcium. You want to make sure you're having at least 1,250 milligrams of calcium per day and at least 1,000 IU of vitamin D per day. Now, in order to get this, you can get it, most of it all, the calcium, from food by having 2 to 4 servings per day of calcium-rich foods, such as milk, yogurt, soy beverages, green leafy vegetables, nuts. All those things contain calcium in them. Now, it's very hard to get enough vitamin D in our diets because the only places you can get vitamin D is from the sunshine, and we don't seem to be having a lot of that lately, even though it's May here in Ontario, or from drinking milk. So most people actually take a vitamin D supplement. In fact, as a dietitian, I eat a very healthy diet, but I can't get enough vitamin D in my diet, and it's the only supplement that I take. So if you're not getting enough calcium and vitamin D, a supplement is by far very important and something you should do. Most people do need to take a vitamin D supplement. So that about sums up all the things that I'm going to talk about in terms of the nutritional issues that occur with a person who has Parkinson's. I'd like to end the talk talking about protein and L-DOPA. And I want to make sure that people are aware that there is a definite issue with eating protein-rich foods when you're taking L-DOPA. Every doctor is going to give you a different schedule for taking your L-DOPA. That's one of the things that you really need to follow, and it's very important for your body to be taking the L-DOPA at the set times that your doctor prescribes every day. Most doctors do it in 4-hour increments, in 7-hour increments. Some people need to take it in 3-hour increments. Whatever your doctor prescribes is what you need to be taking. But the thing you really need to remember is that there is a link between the protein in the food that you eat and the L-DOPA in your diet, and that protein may interfere in the L-DOPA working properly. We know that if you take protein, so eat protein, and take L-DOPA at the same time, when it enters the stomach and it all starts to break down, when it's in the stomach, the body will see the protein broken down and the L-DOPA broken down, and the body will use the protein. It always wins, and it's like you never even took your L-DOPA. That is why it's imperative that your stomach be empty when you're taking L-DOPA. So for all of you who get that thing that says to take your L-DOPA with food from the doctor, the reason why they're telling you that is because of the nausea issues. But you need to make sure that you're not having your L-DOPA with protein. So how do we make sure that that happens? Well, you want to take your L-DOPA a half hour before eating protein-rich foods, and at least 2 hours after eating protein to get the full effect of the L-DOPA. As you can see from this slide that I've just posted, it really explains this quite nicely. And as a dietitian with my clients, I often make a schedule for them looking at the time increments of when they are taking their medication and then when they need to take their L-DOPA, and we make a plan for during the day to make it work for them. Now, you can eat foods that don't have protein at any time of the day. So things like soda crackers and fruit can be eaten at any time of the day, but things that have protein, such as milk, fish, nuts, some vegetables, dairy products, you need to be aware of when you're eating protein and when you're taking your medication. Now, for some people, there have been different ways to balance this diet. So there's some people who just follow this diet, and there's been different theories and different ways that the whole protein thing has evolved. In fact, in the early days, when the knowledge came out about the L-dopa and the protein, there was original people who said, don't eat any protein at all. But we all know that a person needs to eat protein in order to get the nutrients in their body and to feel full. So there have been different things that have come up over the last little while to help people work through the protein in their diets. So one of the ways that people eat is called the balanced protein plan, which is whereby a person follows what I just said. They have a plan where they just don't eat the protein during certain increments during the day, and that works really well for them. So that they're eating small amounts of protein spread out as much as like you and I would eat during the day. So that's considered the balanced protein plan. Then for some people, they follow something called an evening protein plan, where they eat very little protein during the day. So for breakfast, they may have something like non-dairy creamer with Rice Krispies and a piece of fruit. They'll have fruit or a fruit smoothie just made with ice and fruit or rice milk as a snack, and they'll have like a vegetable soup and a white bread with tomato and other salad for lunch, and another fruit for in this afternoon. And then in the evening, they'll have a huge piece of chicken and all other kinds of protein-rich foods, because as we all know, we don't need to be doing as much in the evening, so the medication doesn't have to be working as hard, so therefore you can have more protein in the evening. So that's the evening protein plan. And then for some people, now you have to remember, in terms of these protein plans, everybody's an individual, and everybody is different in how it works for them. Some people feel that they get a different effect from plant proteins as they do from animal proteins, so that they will eat more things like legumes and nuts and soy products that are all rich in protein, and they'll have less meat or animal-based protein because it doesn't have as strong as effect on the L-dopa as the animal-based proteins. But in terms of eating protein plans, everybody is different, and how it affects your body is different. So that's what I really wanted to stress about this. So that brings me to the end of my big talk that I've provided for you today. I hope I provided you with a lot of information. We've left about 15 minutes for questions, but the bottom line that I want to leave you with today is that it's really important to maintain a healthy diet with Parkinson's disease, to maintain a good, healthy weight, and to strategize to help improve your nutrition-related symptoms with your Parkinson's disease. So that's really what I wanted to talk about today. I hope I provided you all with the information you were looking for, and now we're going to open it up to questions.
Thank you, Nicole. You have given us some thoughtful insights and practical information that really demonstrates that good nutrition is essential to the overall well-being of people at both early and late stages of Parkinson's disease. I want to remind our participants today that you can ask questions by typing in your question in the Ask a Question button at the bottom right of your screen. And we will now open the forum for questions. Our first question comes from Julie, who says that her husband is Jamaican and claims that Jamaican foods are far more healthy than Canadian foods. And she's referring to tropical fruits. And she wants to know, because she says she has high blood pressure and some borderline cholesterol issues. Do tropical fruits or vegetables or root vegetables like yams, sweet potatoes, do they fit into the kind of diet that you're talking about today?
So tropical fruits like mangoes and papayas are bright-colored fruits that are delicious and very high in all kinds of great nutrients. So in terms of picking a fruit, I would say that a mango fruit or a papaya or a pineapple or a melon are all awesome choices in terms of keeping a well-balanced, healthy diet. So by all means, your husband's right, and eating all those fruits are going to make you feel good, and your diet's going to be healthy. But don't eat tons of them, because eating lots and lots of fruits can be high in calories, and you may gain some weight.
Wonderful. Our second question comes from Steve. He says, being a vegan with Parkinson's disease. What are the most important dietary concerns in terms of what to focus on, such as sufficient protein, vitamin intake? He says he takes a B12 supplement daily, and he gets those levels tested regularly.
So he answered the question for himself, actually. Being a vegan is, for anyone who doesn't know, a vegan is a person who doesn't eat any dairy products, basically anything from an animal, so no eggs. Your diet is basically consisting of lentils, beans, lots of fruits and vegetables, pulses, soy products. So all those foods are very, very healthy. And as long as you're watching your vitamin B12 levels and your calcium and your vitamin D levels and actually your iron levels as well, you're good to go. And if, like some people say, they have a better effect from their Parkinson's medication if they are vegan, so good for you that you're trying it and hopefully the medication's working better. But by all means, nobody out there should just become a vegan, because I can't promise you that it's going to affect how your L-DOPA is going to work.
Thank you. We have a question from Herda. She says, you mentioned eating a quote-unquote serving of certain foods. What constitutes a serving?
Okay, so if you go online when I'm finished my talk, you can go to the Canada Food Guide to Healthy Eating, and it will tell you exactly what a serving is. But by all means, one slice of bread is a serving, but not a massive slice of bread, just a nice slice of bread. A half a cup of cooked rice is a serving. A piece of fruit that's the size of your hand. And you have to remember that our bodies need about 6 to 8 servings of fruits and vegetables every day and grain products. So you may say, oh, that half a cup seems so small, but you can have more of those than you think, so that's okay. 4 ounces of fish or chicken are all a serving. 2 eggs constitutes a serving. So those are some basics of the servings. I didn't want to spend so much time on serving sizes today because I wanted to get into the good stuff and the stuff you were looking for. But you can, by all means, when I'm done, go look on the website for the Canada Food Guide to Healthy Eating, and we'll tell you all about portion sizes.
Excellent. I want to remind our participants, if they have any questions, they can type in their question at the Ask a Question button at the bottom right of the screen. And our next question comes from Lisa, who says, do you recommend a certain vitamin D supplement? I have heard that different formulations have different efficacies. Is this true?
I recommend one that has a DIN number, that's a healthy Canada one, not made from some who knows where it came from. I buy mine at Costco. If they're on the shelf in a drugstore in Canada, they're pretty much okay for you to be taking every day. You just don't want to take them from someone who you don't know if the supplement has been put forth through some regulations.
Excellent. And Betty wants to know, what are some of the OTC products for constipation? You may have talked about some of them, and she would like to know what some of those products are.
Over-the-counter ones that you need a script or ones that you don't need a script for?
She didn't ask specifically, but perhaps you can just talk about that.
Okay, so ones that you don't need a script for would be things like Metamucil that you drink that bulks up the fiber in your diet, or there's a product called Benefiber that's something else that bulks up the fiber. But the one that I spoke about today that I'm recommending the most that we use, that I said that I wish I had stocking because we go through so much of it here and I recommend it so often, is a product that's called PEG 3350. And what it is, it's a product that has been made here, and they sell as either Laxaday, Restoralax, Relaxa. There's all different kinds of names for the product. I say whatever one's on sale, you should buy. So that's really what the big over-the-counters are. And then there's some stool softeners that exist out there that you can buy, like Docacet. But the biggest thing I would try first would be to try the PEG 3350 products because they seem to work the best.
Perfect. Sue asks, my elderly father was diagnosed 2.5 years ago, and over the past couple of years, has had considerable problems with crumbling teeth, loose teeth, and tooth loss. Would this be related to the osteoporosis that you talked about? And would the suggestions you mentioned be of enough help at this time?
So I am not a dentist, but as people get older, their teeth start to they've been working for many, many years, and if they weren't cared for well as a child or during life, often they don't age well, our teeth. I've heard many people say that your teeth are one of your most important organs in your body, because if you can't have good teeth, you can't eat food, so it's very important to keep your teeth healthy. I don't believe it's part of the Parkinson's, and I don't think it's part of the osteoporosis. I think it's just aging teeth that can be dealt with a dentist to help.
Great. We have a comment from one of our participants that basically is saying that he's been taking all of his medications with his meals, and so what you talked about was really important, and wants to know if it's okay, based on what you talked about and the empty stomach, to take the other medications at that time as well.
So other medications that are not Parkinson's-related medications, it depends. Some medications can be taken with food. Some medications can't be taken with food. And it's really important to review all of that with a pharmacist.
That's great. Thank you. We have another question here from Jacqueline, who says, I've had Parkinson's disease for 17 years, and although I'm eating smaller meals, I'm still gaining weight. Do you have any suggestions?
Exercise, if you can. Exercise is very important to try to do. Watching your portion sizes diligently, changing up, maybe having some more, being just very cognizant of the calories that are going in versus the calories that are going out. Unfortunately, sometimes just age and lack of exercise causes us to gain weight, and often we just have to be happy with the body that we have and eating healthy and feeling good about ourselves the best we can be, and not worrying that there's maybe an extra 5 or 10 pounds on our body, and just feeling good about ourselves, but just trying to eat a well-balanced diet and getting all the nutrients that we need, and trying not to eat all the treats.
Excellent. Are there any contradictions between the supplements you recommended and Parkinson's medications?
Vitamin D? No, absolutely not.
Okay.
The only supplement that you have to be concerned about and taking at the same time as L-Dopa is iron. So you can't take iron at the same time as you're taking your L-Dopa, because they counteract each other.
Thank you. And I want to just remind our participants we have a few more minutes left. If we have any additional questions, you can just type your question in the Ask a Question button at the bottom right of your screen. And the next question is, I have seen Parkinson's diets online that say they improve symptoms naturally by eating certain beans. Do they work?
So there are some beans that have natural L-Dopa in them. So people who may have early symptoms of Parkinson's before they've started medication, or they want to try to see if these beans can help, I would say go for it, try them. I can't say that taking a supplement that have them in them is going to help, but by all means, you can try these beans to see if it helps. But every body is going to be different. As we all know, every body reacts differently to L-Dopa as well, so it's the same kind of idea.
Thank you. We have a question from Carol that says, what's the best strategy for basically combating weight loss and reducing dyskinesia? My sister, who has Parkinson's disease, is down to skin and bones due to dyskinesia. She consumes a lot of empty carbs. Would reducing sugar and flour in her diet help? And what would she replace with that to fuel and nourish her body? I hear her dyskinesia is like the equivalent of extreme exercise.
Right. So 100%, some people who have such severe dyskinesias are burning tons and tons of calories, and those calories need to be replaced, and they need to be replaced with anything and anything that the person's willing to eat. So if they want sugar, give them sugar. But fat has the most calories, so you want to give the person more high-fat foods. I often tell my patients who are losing weight a lot to have tablespoons of olive oil. There's 100 calories in 1 tablespoon of olive oil. Have avocado. Have a smoothie. Add to and use whole milk and use full-fat ice cream that's really good ice cream like Haagen-Dazs. Have cream. Have avocados. Have fatty everything, and also a well-balanced diet in it. Because if you take away things, you're at risk of actually losing more weight. So you want to make sure it's a well-balanced diet, including all varieties of foods, and not taking away anything to get that weight up as much as possible.
And I'm just looking at a couple of final questions here that we have. One of them is a follow-up to what you were just talking about, and they're asking what beans contain L-dopa.
Fava beans.
Okay, thank you. And another person asks about Restoralax, which you mentioned, that says it has a warning regarding dependency. How should I deal with this?
So we know not to follow the rules on that label. I know of kids who've taken that medication 365 days a year since they were babies, and they're now 14 or 15 years old. There is no dependency issue on that Restoralax. Keep taking it. Don't worry about what the label says.
Thank you. We really appreciate your talk today, Nicole. And on behalf of Parkinson Canada, I want to thank everyone for participating in this afternoon's webinar. For more information on living well with Parkinson's, or to access a recording of today's webinar for future viewing, please visit our website at www.parkinson.ca. If you have questions regarding today's session or additional questions, feel free to contact us by email at info@parkinson.ca or call us toll-free 1-800-565-3000. Now, before you log off today, please take a few minutes and give us your feedback by completing a short survey. Your input today is important and will help identify topics of interest for future webinars, as well help us meet your needs better. Thank you so much, Nicole, and thank you for participating today. Have a wonderful day.